people diagnosed with COVID to date, we have 429. Did the slide advance? I'm sorry.
It did not.
Okay, so we have 429 actual people who've been diagnosed with COVID. To date, there have actually been 430 diagnoses. We have one diagnosis. Says we have one person who had tested negative and then was retested and found to be positive a second time. By placement type, we have a total of 206 people who lived in a supported living setting, 114 in intermediate care facilities, 56 in natural homes, 37 in residential habilitation settings, 9 in host home, 4 in out-of-state placements, 2 in nursing homes, and 1 in a mental health facility. In terms of COVID infection rate and death rate by placement in intermediate care facilities, 38% of all people living in ICFs tested positive, with a total of 21% of all deaths being accounted for in intermediate care facilities. And the confirmed death rate of that 21%, 11% total were actually confirmed as having died from COVID. In natural homes, 6% of all people were diagnosed with a positive COVID test. And of all people living in natural homes, 8.9% of the deaths accounted for people who lived in natural homes. And in terms of confirmed deaths, it is 8.9. In residential habilitation settings, 33.6 people, 33.6% of all people living in residential habilitation settings tested positive, with a death rate of 8% of all people in residential habilitation settings, with a confirmed COVID death rate of 5.4%. And supported living, 22.1% of people living in supported living tested positive, with about 10% of the deaths accounted for from people living in supported living, and 7.2% of those people who died were confirmed. Overall, for all settings, 17.8% of all people tested positive for COVID, and a death rate of 13.2%. And of those, total deaths confirmed, 8.6%. In terms of COVID positive rates by placement types, this chart just gives you a breakdown of the settings where people live. Fortunately, we have had no diagnosis in the month of May, nor the month of June to date. Of the people who tested positive for COVID, we have a breakout of 144 of those people requiring hospitalization inpatient, and again, no inpatient hospitalizations in May and June because no positive cases. And currently we have no one of the people who tested positive hospitalized. Of people diagnosed with COVID, we have a total of 57 who have died. We have 14 of those 57 confirmed as not COVID related, and we are awaiting confirmation on 6 of those outstanding cases. So to date, there have actually only been 37 confirmed COVID related deaths. And this chart gives you a breakout of the 37 who have been confirmed as having COVID-related deaths. I should just let you know that for the month of March 2021, we have a slight error. So there should be 2 in that month opposed to 1. So if you count the bubbles, you'll get 36. But the month of March will be correcting that slide to add 1 more person. Provider staff diagnosed with COVID. To date, we have 697 who've tested positive for COVID. 51 of those people work for more than one provider. And unfortunately, 10 of the staff have died from COVID to date. Vaccinations rates, people supported by DDA, we've reported as of yesterday a 74% vaccination rate. Host homes accounting for 72% total people in host homes having at least 1 vaccination. In ICFs, 96% of people living in ICFs have been vaccinated. In natural homes, 57% vaccination rate, and in residential rehabilitation settings, a 94% vaccination rate. Supported living, 83% vaccination rate. And of provider staff, as of 6/17, we have a 56% vaccination rate. And that, folks, is the end of our COVID-related data. We're going to open up now to see if we have any questions that have come in. And hopefully I'm not sharing my screen anymore.
Winslow, you're still sharing your screen.
Oops. I will. Oh, gee. Okay. All right, we'll take any questions as I try to eliminate my sharing my screen.
So I made myself presenter, so you're no longer sharing them on the screen.
It's always great to have help. All right. Do we have any questions that were presented? And I know we had a question about variants, and I believe we have Dr. Denson from the DC Health here to answer that question. Dr. Denson, are you available?
Hi, good afternoon, everyone. I am here. Was there a specific question?
Well, we had some concern about the variants of the new variants that are being discussed in the media. And we were wondering if you could share about the variants, your knowledge about the variants.
Sure. So all of the variants that have been discussed in the media of being what they're calling variants of concern, so variants that are more transmissible kind of in the first baseline COVID-19 variant have been detected in the US at large, and also specifically in DC or in the DC metro area. Obviously, you know, every positive result does not necessarily sequenced, or, you know, it doesn't necessarily have their DNA tested. So we don't have an absolute number of how many of our cases are the Delta variant, which is the one people we're hearing about a lot now, which is the one that was originally identified in India. Our public health lab does kind of surveillance, so they sequence a certain number of positive tests every week, and we also sometimes get lab reports from LabCorp as well. So in this past week, we've had, it's like 4% of what's been sequenced were the Delta variant. So that doesn't mean 4% of all positives, but just 4% of the small subset of samples that were sequenced. Right now, we don't have a good sense about whether those are all imported cases from someplace else, or if they actually were infected here, just because we don't have enough information yet. But the Delta variant has been detected in DC.
Now, Dr. Denson, from a public health perspective, what would you say the public should be concerned about with regard to the variant?
So similar to I'm going to compare it now to the British variant. Remember when the British variant first came out, and the news was saying, "Oh, this is so much more transmissible," and it kind of got to a point where it almost replaced all of the other circulating virus in the UK. So for comparison now in the UK, the Delta virus has almost replaced that first British variant. So this variant is more transmissible. We were still waiting on more data to see if it's actually causes more severe illness. But just kind of playing the numbers, since it's more transmissible, since more people can get sick, it may result in more deaths just because it's infecting more people, if that makes sense.
Is the current vaccination effective against this variant?
Yes. So the vaccine is effective against the Delta variant. There may be more more people who test positive, but in terms of people who get sick and in terms of the preventing severe illness and preventing hospitalization, the vaccine is still very effective at doing that.
So as a leader within this in the delivery system, uh, I I I believe it would be important for us to continue to ensure that people who are vulnerable, whether they've been vaccinated or not, are taking precautions to mitigate the virus by practicing safe distancing, hand hygiene, and other uh, mitigation strategies. And though, you know, many of the restrictions have been lifted, I think that, we should be very cautious with people who are vulnerable and susceptible because of other comorbidities.
100%. I fully agree. Even when the British variant first came out and we didn't have information on whether or not the vaccines worked, and everybody was upset, one of the first things we started saying to people was all the things that you did to not get COVID before still work. So washing your hands, not touching your face, maintaining social distance, all those things work for any, variant, works for the common cold, works for the flu, right? So even though the things about the variant sound scary, the basic things that we do to avoid getting sick also still work. But vaccination, vaccines work. The, serious side effects are rare. But like you said too, just, maintain vigilance, particularly with our vulnerable populations.
Dr. Dennison, I can't thank you enough for being here for us today because, you know, we here try to answer as many of the questions we can, but, we have to defer to your expertise and those at DC Health when it comes to most of this. And we thank you guys. Uh,
Yeah, we're always happy to help.
appreciate that. I see we have one question that just came up, and I'm going to try to. So, we have a question. Is there any information on the version of the Delta variant spreading? I believe that question was answered. And Deputy Kirk Dobson says, while the goal is to provide education and encouragement on the safety of the vaccine, providers may require staff and people supported to receive the vaccine. What guidance, if any, does DDS give providers regarding vaccination requirements?
And that question is coming from somebody in the community. I just reposted it to the Everyone group.
Oh, thank you, Kirk. The so those from DC Health, if I stumble over this, please correct me, but to date, I don't think there are any requirements for providers to have, there are not vaccination requirements. However, we are strongly encouraging providers and their staff to ensure that their staff, as well as the people supported, are vaccinated.
Just to hop in from a DC Health point of view, the DC Health also has not put out any statements requiring vaccinations of providers, but the CDC has put out a statement for people who have concerns about EEOC and concerns about whether or not individual businesses can require vaccinations. Daryl, I don't know if you have that link handy to post in the chat. But for any places that are considering it, you do have some backup from the CDC.
And the acronym EEOC, I believe, stands for the Equal Employment Opportunity Commission.
Yes.
Thank you. We have a note from one of our providers. We have a large immigrant population that work in our field. It's important to know when international travel occurs and educate our employees to the CDC and DC Health guidelines. Also educate on how now more than ever the importance to get vaccinated! Exclamation point for emphasis. Thank you so much for that comment. We have another question. Do we have information whether anyone in the 4% Delta variant cases in DC are vaccinated people? What were the outcome of those infected with the Delta variants in terms of illness, hospitalization, and deaths? So I will defer to DC Health on that.
Sure. So again, remember that 4% doesn't necessarily mean 4% of all cases now in DC are Delta variant. That was 4% of a limited sample size. So that's one. Two, since these are surveillance samples, we don't have any other clinical information. This is genuinely just surveillance of the samples that we had at the public health lab. So, and even if I did have that information, probably for confidentiality reasons, I probably wouldn't be able to share it. But all we have is just basic surveillance information right now.
Thank you. We have another question. Is DDS considering offering financial or other incentives to encourage provider staff in their own staff to get vaccinated? With regard to the first part of the question, the provider staff question is yes, we are considering incentives, and with regard to our own staff, the city, which is DC HR, has offered an incentive for people to report their vaccination status. And I will defer to our HR executive on that, because I know there is an incentive, and I'm vaccinated, so I believe I'll get the incentive, but I'm not certain whether it's reporting your rate, but I believe it is reporting your having been fully vaccinated before you get that incentive.
And that is correct, Winslow. The incentive is only afforded to employees who are fully vaccinated.
Thank you, Jessica. And Daryl Hawkins from DC Health has posted the link to the Equal Employment Opportunity Commission's COVID-related questions and employees. Very helpful. And we have a question on what is the incentive for those working for the district. If you're fully vaccinated, you will receive a day off. I believe it's a day off. And with regard to providers and their staff, we have not yet finalized specifically what incentives, but we are discussing the use of incentives.
At this point, Winslow, if you don't mind, I'm going to ask Danielle Darby if she's able to speak to some of the efforts RCM has completed to incentivize their staff. Danielle, are you available at this time?
Excellent idea, Kirk.
Sure, sure. Thanks, Kirk. So, excuse me. We've actually seen a pretty big uptick in our number of staff that have been vaccinated. Recently, we've been giving since the vaccine's been available, we've been giving staff $50, which sounds kind of minimal, but I mean, the reality is we have a lot of staff, so we have about 310 staff. So, you know, the exposure is quite large. And so we started with that. And then we realized that it was going to take a lot more than a $50 incentive to get people vaccinated. So we kind of, with my clinical director and my HR person, we kind of brainstormed some ideas, and we came up with, we first started with giving our mid-level managers large bonuses for getting staff vaccinated, because we realized, who do the staff trust most, right? So it's those mid-level managers that they see day in and day out. And so we started with giving them large bonuses, upwards of $3,000 a piece, based on the percentage of staff they got vaccinated. So if it was 70%, 80%, 90%, et cetera. So we did that, and that worked quite a bit, actually. We had a couple of teams that hit the 90% mark with all their staff, which I think was exciting. And we have several staff that are getting closer and closer as we speak. So, so that was one thing. And then we decided to do a kind of just a raffle. You know, you've seen it on the news. States are giving away $1 million. Clearly, we don't have that to give away, but so we came up with 3 things that we wanted to, kind of large ticket items that we wanted to give away with on a raffle that we're actually having on July the 6th. So anybody that is fully vaccinated or at least received 1 dose is eligible. And then if they're a person who just has 1 dose, they have to wait to get the gift until they receive their 2nd dose, just so we can confirm that they actually receive it. But the prizes are large prizes, so we're giving away $3,000 cash. The second prize is a weekend trip to either the beach or the Chesapeake Bay or Great Wolf Lodge for those folks that have kids. We know kids love that place. And then the third thing was an iPad. So once we announced that, our numbers shot up dramatically. And then we're also giving away $250 cash every Friday in the month of July, in addition to that as well. So we've had a pretty tremendous spike in our numbers. I think I told you earlier we have 310 staff. As of 2 weeks ago, I don't have my current count, I apologize, but we were at 207 staff vaccinated. I know we're higher than that now, but it really has been a big incentive. I feel like we were hovering around the 30% mark forever. Those were the people who obviously were eager to get the vaccine. And so through a lot of work, we've gotten up to 70% or so. And I think the last thing I'll say is the other thing that really helped is 2 of our most trusted folks in the organization, which is our clinical director. I feel like everybody knows him. And then our training person, again, somebody that everybody's gotten to know throughout the pandemic because they've been doing virtual trainings the entire year. So what they did was they took it upon themselves to call individually everybody who's not vaccinated and speak to them and kind of get what their fears are. You know, is it something they're thinking about? They're absolutely not thinking about. What can we do to help? And so I think just a little bit of a personal phone call kind of gave a few folks the push they needed. And then also we have our primary care doc kind of at our disposal if we need folks that want to speak with a physician and the physician is not available, et cetera. Just to give guidance, not give medical advice, but guidance. So those are some of the things that we've done to really boost our numbers over the last, I don't know, 45 days or so.
Thank you, Danielle. That's most helpful. It sounds like very creative and thoughtful way to try to move your organization forward. Thank you for your efforts. We have a comment. Thank you for this information, Danielle. Creative incentives. It's kind of quiet. I think these calls are very helpful, particularly those additions to the call that are from our providers, our advocates, and our partners at DC Health. They have a question. Does anyone know whether people receiving services have requested that their DSPs get vaccinated and whether that has inspired DSPs to get vaccinated? I'll leave that open to anyone who can answer. I know from meetings we've had with Project Action, several of the self-advocates who are regular participants on that call have stated their concerns with their staff being vaccinated and have pretty much requested that staff work, at least one I know of that requested that staff working with them be vaccinated. So I'll leave that open if anyone wants to chime in on that. And then we'll move forward to, it would be great to get similar presentations from other providers about their efforts. And then you have Danielle, did you learn anything unexpected about fears through the individual phone calls? So Danielle, if you're still on the line, and for any other provider that would like to add what they've done in terms of incentives to their staff or encouragement education, we'll welcome that. But I'll go back to Danielle. She's still on the line. The question is, did you learn anything unexpected about fears through the individual phone calls?
Thanks for the question, Robin. I think since I didn't personally make the phone calls, I don't know what everyone said, but I do know from conversations with my clinical director, who's actually on the call and may be able to answer better than me, if somebody wants to unmute Berhani Tessima. But I'll just say what I know, which is a lot of people had misinformation. A lot of folks, excuse me, fears were around how quickly the vaccination was developed, and we kind of went through the whole process and said, you know, that's not actually accurate. And so we kind of gave a lot more information. This is information we've given many times, but again, it's just people don't always look at what we give or pay attention when we're hosting town halls or actually join, et cetera. So a lot of it was around misinformation. And the other thing was, you know, other reasons are, you know, my brother, cousin, uncle, mom had a reaction, and now I'm scared to get the vaccine. And so kind of just talking through those fears was helpful. And I don't know if Berhani has anything he would like to add if he's unmuted.
He has the ability to unmute himself. I can't unmute him, but he is able to do that.
All right, so I'm on. Good afternoon. Can everyone hear me now?
Yes.
Sure. Thank you for the opportunity. So we did make a call individually to see what was the reason why people hasn't been taking the vaccine. And for the most part, as Ms. Darby mentioned earlier, it is, disinformation or misinformation from mainstream media, social media, and, people that, the staffs, trust is most importantly. So we kind of had a one-on-one conversation what their concern is. So we were able to get most people vaccinated at this point, in addition to the creative incentives we talked about. We also noted that every single person who is pregnant, declined taking the vaccine, which is partly understandable. We only have about roughly, I would say, less than 20 people who are still undecided because they are not totally interested in taking the vaccine or they have experienced some sort of unwanted effect or they have heard about people sharing, a certain side effect of the vaccine in general. So pretty much it's the common disinformation and misinformation that has been the most common problem. We try to address that, myself as well as the primary care physician for most of our people supported. But obviously, as I said, most did get the vaccine and few more are getting the vaccine before the end of this month. There's a handful of them who are, still not totally interested in taking the vaccine.
Thank you for your efforts, Brahani. We have a question. Is there any plan that with higher vaccine rates among DSPs, masking requirements would change? Is there any sense that fully vaccinated DSPs would eventually not be required to mask? A number of our sister organizations in other states have been able to implement this type of system, and a few of our team have asked if this would be an option for our DSPs. Well, I will defer to DC Health because, as you know, all of our guidance comes from DC Health with regard to requirements in settings. So I will defer to my colleagues at DC Health on this question.
Thanks, Winslow. This is Nelson from DC Health. I'd like to start off by saying that it's great to hear that other states and areas are progressing to that point. We are continuing to evaluate information that comes from the CDC to evaluate our current guidelines. We do that all the time, constantly, especially during the pandemic. And one thing I can say to answer that question specifically is future plans really are going to depend on the setting. There is, those of you that don't know, some new OSHA guidance that either I think became effective June 21st. It's a new emergency temporary standard, which I'm not yet an expert on, and so I will defer any questions for right now on it, but it is available to read online. But OSHA has put out some very specific COVID-related mandates, including masking and social distancing and things like that. And so some of the lifting and the removal of those requirements are really going to be based on their definitions and those settings that will be allowed to do that. I hope that answers that question. We're going to continue to evaluate, and we definitely understand that we don't want these masks to be forever, but we also need to make sure that what we do is evidence-based for the safety of a very high risk and susceptible population.
Thank you so much, Nelson. We have in the chat, we have an announcement, and that announcement comes, Health and Joy is inviting you and all people we support to a monthly virtual Zoom party. The topic is Hodge virtual monthly party with live DJ. It's the last Friday of each month from 6 to 7 p.m. And the theme this week is celebrating Michael Jackson's anniversary. And it's a Zoom meeting, and the link, meeting ID, and passcode are uh, within the chat. I don't know how we can best share that with people who are not on the actual uh, WebEx via computer. So if there's a way we can share that, I'll defer to our great support team to be able to share that. And we have another one, especially the use of face shields in the home. They are not using face shields in hospital settings in DC. So why are we required to do so in a small home environment? And I believe that's a question and commentary for which I will also defer to our expert colleagues at DC Health.
Hi, Winslow. This is Daryl Hawkins from DC Health. I do want to clarify that we still currently have guidance for required personal protective equipment for healthcare personnel in healthcare settings. So healthcare settings in this regard is, refers to ICFs, for example, and CRFs. And in that guidance, along with hospitals, eye protection is required while we're in phase 2 if the healthcare personnel is within 6 feet of a patient or a person supported. So while perhaps in hospitals you're not wearing them, you're not seeing the healthcare personnel wear it throughout universally, they still have those requirements in place while we're in phase 2. And that guidance can be found on our website that we always kind of plug, but it's on coronavirus.dc.gov/health guidance. And I would also refer, obviously, all of your providers to take a look at our specific guidance for their setting, for supported living and CRFs, and also for ICFs. We have guidance there that kind of outlines that, but also refers back to the required PPE for healthcare personnel.
Thanks, Dara. We have a question. Has there been any final determination that day providers are to follow, quote, retail/services, end quote, COVID requirements? Day providers were told last week that it would receive confirmation this week, but the day provider meeting was canceled.
I'll take that, Winslow. So yes, day providers should be following the general retail services guidelines at this time. They are not to be following, or the guidelines for day services, adult day services on the coronavirus website do not apply to our day services providers. If you have any other questions, please follow up with your QRS, your quality resource specialist, who can better guide you. Again, there are no updates. You should be following that general guidance for retail and services.
I would also just add that the day services, adult day services guidance that was on the DC Health website has been removed for quite some time. It's been several weeks, if not a month, that's been removed.
Thank you both. Any update on the DC planning for the use of the ARPA funds?
Do you want me to take this one, Winslow?
Sure.
So the Department of Healthcare Finance, DHCF, held their public input meeting this Wednesday that just passed. And so we are still in the public information session part of this exercise, as well as still trying to get additional suggestions for items that could be funded using ARPA. Once we have completed kind of getting that public input, we will assemble what we have, DHCF, DDS, and other agencies involved, and we will post that to the website that has been created on the DHCF portal and share it with the folks on this call as well. So we are still in the planning phase of getting public input and compiling all of that together.
Just as a general information piece, uh, the district is not actually receiving funding. The district has been afforded the opportunity to decrease its share of the Medicaid payment, and that money was budgeted well in advance. And because we don't have to pay as much for the services that we're delivering, our share has been decreased, and the ARPA funds are actually coming from our being afforded to decrease the amount of our share for a set period of time. It's not unlimited, but it's a set period of time.
Winslow, it's Nelson. I'd also like to just add that it looks like the OSHA new emergency temporary standard was published on June 21st, and it became effective at that time. My colleague Andrea has posted in the chat a link where providers can go and read that. I would encourage them to do that sooner rather than later, as there are time limitations. Some of them are 2 weeks, and some of them are like 30 days for to become compliant with the new guidelines. And so I'm not sure what fines are associated afterwards, but I'm sure there are some. So you are encouraged to check that out. And we are still also digesting it at DC Health to see what, if any, impact there has on our current guidance.
And for those on the phone, it is OSHA, OSHA.gov /coronavirus/ETS. And the DC health guidance can be found at coronavirus.dc.gov/health guidance.
And just to add to that, Winslow, I would, I share the sentiments that Nelson just stated, because there are some requirements that are 14 days from that time. And a lot of these requirements apply to healthcare type facilities and healthcare settings that have employees of 10 or more employees. So please get to that website as soon as possible to try to review the requirements that are laid out.
There is a question, as our people start going back to day services, what is the rationale behind following retail guidance in day services, yet having vaccinated employees in homes with fully vaccinated people adhering to much more stringent PPE requirement in the homes?
I can try to answer that. Oh, go ahead.
No, I was just saying, can I just ask whoever just posted that question if you could post it to the everyone tab, because so we can see? I just haven't seen that one.
It is.
So
go ahead. I'm sorry.
So that's okay. I can try to answer that question. I think I discussed this several weeks ago also when we announced that we were going to be removing the adult day services guidance. A lot of it, there was extensive discussion with senior leadership, and a lot of it has to do with that the facilities aren't directly licensed by DC Health, and so that really was a major factor in determining removal of those guidelines. That being said, we have offered multiple times and had conversations with DACL and other leadership for these day service programs, and offered to collaborate with them in development of their own guidelines to be able to ensure a safe environment. We've had some interest, but not much interest in that, and so DC Health is, available to collaborate in that effort. We want to make sure that, it's very strange when we have guidance and then suddenly we don't have guidance. There's a little bit of a vacuum there sometimes, and so we definitely want to help bridge that and get back to pre-COVID, where facilities are making their own policies and things like that, and we're definitely able to assist with that.
We have another question. What is the rationale for staff wearing face shields when both the staff and the persons supported are vaccinated? Any plan for DC Health reviewing the merits of requiring wearing face shields in line with existing scientific evidences for community-based residential facilities, including ICFs and CRF?
So the current guidelines still from the CDC are that while there's moderate to substantial community spread, eye protection is still recommended for healthcare personnel. And so, like we've stated before, we have added in our PPE guidance for healthcare settings that while DC is in phase 2, as Daryl said, eye protection when within 6 feet of a person supported is required. And when DC transitions into phase 3, eye protection will no longer be required. So as I shared, I think a couple of weeks ago, DC is in, leadership is in discussion, looking at our current rates, transmission rates and case rates into transitioning into phase 3. And so I think we do have that to look forward to.
We have another question. It is my understanding that supported living homes are not directly licensed by DC Health, while ResHabs and ICFs are. Can DC Health clarify?
Hi, this is Daryl Hawkins, and I'm not sure if Karen Stringfield is on the line. She can probably quote this off the top of her head, but currently DC Health directly licenses ICFs and CRFs, supported livings, which are not CRFs or ICFs are not licensed directly by DC Health.
That is accurate.
Yeah, I was
I
going to say hi
believe
to
that
everyone. This is Karen. That's accurate. Thank you.
Thanks, Karen.
we are at 12:54. We can wait these few minutes out to see if anyone has any additional questions. The OSHA regulations indicate it is not to apply to, quote, home healthcare settings where all employees are fully vaccinated and all non-employees are screened prior to entry and people with suspected or confirmed COVID-19 are not present, end quote.
Yeah, I can, that is correct. So it also doesn't apply to settings. So an example would be an outpatient clinic who purposely screens any individual that may have COVID-19 and does not provide services to anyone with COVID-19 or suspected COVID-19 symptoms. But I will, in addition to the OSHA ETS, if the setting does not apply to that, we also want to reemphasize that that DC Health has guidance for healthcare settings, including home health services and required PPE for those individuals. So looking at both and checking both links, that depending on your setting and the population you serve and understanding which regulations apply is really important.
And there's some clarification to the question. The first question is my understanding that supported living homes are not directly licensed by DC Health, while ResHabs and ICFs are. Can you clarify? And we have an additional clarification. I asked because Nelson seemed to suggest face shields were required in sites licensed by DC Health. I believe they're also required in supported living homes.
So just to clarify, my comments about the licensing was directly related to the question about why we removed guidance related to adult day programs. The licensing answer had nothing to do with the face shield requirement that DC Health has for healthcare providers.
And another question, is this how, and this is a follow-up to the OSHA regulations, indicated does not apply to home health care settings where all employees are fully vaccinated and all non-employees are screened. The follow-up is this how it will be assessed by DC Health when creating guidance? And so I'm guessing that that question is asking if DC Health is going to update its guidance based on the OSHA regulations. So.
Oh, okay. Sorry, I was trying to understand the question before I answered. Like I said, DC Health is still digesting, what is in the new emergency temporary standard by OSHA, and we're evaluating how, if at all, our guidance is impacted. We will not be contradictory to OSHA regulations, and providers should still follow OSHA regulations.
And we have another, due to the facts that supported living is not licensed by DC Health, does the face shield apply to those settings? So the question is, I would say, is if you're supporting someone in a supported living setting, do you have to wear a face shield? And my understanding, go ahead.
Oh, go ahead, Winslow.
No, I was just going to defer to you. So
Okay. Our DC Health guidance for CRFs and supported living currently says, in addition to universal masking, staff must wear eye protection when within 6 feet of persons living in the facility while we are in phase 2. So again, I would just one, reference your specific facilities guidance on our coronavirus.dc.gov website under health guidance. And we do have a guidance document that is directed just for supported living and CRFs. In addition, I will also, sorry, go ahead, Winslow.
No, I was just going to say what may be helpful, and you all at DC Health can correct me, when you all are issuing guidance on strategies to mitigate the spread, you are responsible for licensed facilities as well as the general health of the public.
Correct.
Okay.
I will also add, going back to the OSHA question, DC Health, continues to make sure that our guidance, aligns with federal regulations, that we are not more lax than federal regulations, and that in addition, that we look at our guidance based on our local transmission and information and best scientific guidance to provide our guidance. So our guidance may be more stringent than other jurisdictions, or even sometimes some federal regulations based on what we are seeing in our local spread transmission in our community and based on the most available scientific evidence.
We have a comment. DC Health has. DC Health.
This is Andy. I was just wanting to jump in for a second and also point out to people that the mayor's orders starting all the way back in April of 2020 established some authority for putting a lot of this in place in placements where people supported by DDA lived. And in the most recent order, what the mayor said in removing that was that DC Health would issue guidance about the appropriate steps that needed to be taken. And so the authority, while supported living might not be licensed by DC Health, the authority for DC Health guidance controlling in that circumstance is the mayor's orders. And those are also on the coronavirus website.
So I think that comment answers I'm sorry, I think that response answers the comment. That is, DC Health has been treating supported living from the start as though supported livings are DC Health licensed facility. I question that interpretation, and I think Director Reese's response prior to me reading that comment may have answered that, had directly answered that comment. Well, folks, it has been a wonderful, informative, collaborative forum. I just hope everyone has a safe and enjoyous rest of the afternoon and weekend, and we will be looking forward to meeting with you again next Friday. This last comment, I do want to clarify that as providers, we are extremely grateful for the support DC Health has provided. I think that is a wonderful way to end this call. I thank all of you who participated, providers, advocates, stakeholders, and be well, folks. Oh, yes, they have been super responsive, and you're quite welcome, Carol. Ever appreciative for your participation and your efforts on behalf of the people we serve. Thank you, everyone. Have a great evening, great weekend. Goodbye.